Hey, congratulations on downloading my free video course on how to fix your back pain. My name is Alan O'Mahony, and today I wanted to touch on some of the common causes of back pain and how over the next couple of videos we're going to dig in much more detail and about some of the physiology behind back pain, some of the common causes of it, and of course how we can fix it through mobility, flexibility and strengthening exercises. So about 12 years ago now, I slipped 2 discs and cracked 2 vertebrae, which was a pretty major injury. It ultimately retired me from my sport, which was Thai boxing, and for the first couple of years, it was bad. I was struggling to put my shoes on, couldn't even put my socks on. Any sudden movement would just have me absolutely floored. So over the years, many years of physiotherapy, exercise, self-education, official education, everything and anything, I am now fully cured. I can squat, I can deadlift, I can run, I can do everything and anything 100% pain-free. Which is why I wanted to put this video course together for you, so you can avoid some of the things that I've done when I was younger, and hopefully make you fitter, make you stronger, and of course have you pain-free. So one of the many very common causes of lower back pain, so again, if we look at the spine here, and this side is the back of the spine, and of course this being the front of the spine, is tight lower backs. So a lot of the time we will feel our lower back and assume it's our lower back that's the problem, but that's actually not always the case. In fact, I would go so far as to say 9 times out of 10, it's not your back's fault. It's something else that's causing that. So you look at a lot of people, and posture-wise, maybe because of sitting, lack of exercise, certainly weak muscles, posture-wise, it'll be like this. The back tends to be very hyperextended and overarched. Now, a couple of things are going on here. So, of course, we have all the joints here and the discs being compressed by this bad posture. What's also happening then is that all the muscles on the lower back here, particularly the erectors, they're getting shorter and shorter and tighter as well, which is also causing a lot of pain. But if we think about a little bit lower down into the pelvis, then when the pelvis tips forward, then all the muscles in and around here, which will be your glute muscles, are being lengthened and weakened as well, whilst all the muscles on the front are being short, with the predominantly your hip flexors and lower abdominals, are being shortened and much tighter. So we have a whole host of issues going on all of a sudden. Now, if you went to a GP, the common piece of advice, which is terrible advice, they will just say, go away and strengthen your lower back. So if you follow that advice, and again, positionally you're like this, you're going to start doing a load of exercise that's going to strengthen the strong muscles already. So you're actually just exasperating that same issue. You're going to cause more pain. You're going to cause the pelvis to tip further forward. You're going to cause all the hip flexors and the abdominals to get shorter, tighter and weaker. You're going to cause all the glutes to get more underworked and more inactive. And you're on this vicious cycle. So over the course of the next couple of videos, I'm going to go into more detail as to why I choose certain exercises, why I don't do other exercises, and for you to pick and choose which ones suit you based on some of the symptoms and some of the reasons I go into. A lot of it will be, so some of it, particularly the stretching and flexibility side, we will not just look about flexing the spine forward. So if I take this down, so again, if we think this is our lower back, yes, stretching and flexing the spine forward is going to give us a bit of short-term relief. However, it's not going to fix anything long-term. So what we'll also think about doing is side flexing the spine. We think about extending it. What we're also going to do is rotate the spine. So we're going to move in many different ways that you won't have thought or seen it before. But again, I want to do these separately, so we can go into a little bit more detail on each. So keep an eye out for the next video. It's going to be in your inbox tomorrow about roughly the same time. We're going to go into more stretching and flexibility of the spine and the pelvis to give you much more relief really, really quickly. Look forward to seeing you. Take care. Bye.